Hello Africa and welcome to the Stock Exchange in Johannesburg. We're live here from the biggest financial market in Africa, and we're talking to Life Healthcare Group, and it's a big day for them, and this is the biggest single private placement in South African history. Let's get Mike to tell us the detail of why they came to the market. But first of all, Mike, let's talk about the difficulties that they've had to endure before we talk about the football. Let's talk about the difficulties that they've had to endure to come to the market at this particular time when economies are struggling, and also there are these questions around what the National Health Initiative in South Africa is going to bring about.
Yeah, good morning, Godfrey. I guess the issue of coming to the market at this time is around the volatility worldwide. And a lot's been written and said about the fact that we reduced our pricing and the volume of it. But we felt comfortable that at that price and that volume we'd be able to place the share on the exchange, which was important for our shareholders and for the company itself. So while it was a pretty volatile and a turbulent process, certainly we think that we've achieved a very good result. One shouldn't discount the fact that this is a large amount of money that was raised in this largely secondary issue.
Yeah, because I was going to raise the fact that you're coming in at a difficult time, but you're also raising a large amount of money. 5.3 billion rand is a lot of money. Have you had difficulty in convincing investors to buy the stock? I know you've had to cut the price.
I think what is very encouraging, and we did an international roadshow and approached local investors. I think what is very encouraging was the enthusiasm they had for the asset. Whatever's been written and said, no one's ever said the company is a poor asset or has performed badly. And then it comes down to pricing and valuation that people put on the asset.
Yeah.
And that's something that's individual and I can't really influence. There was huge interest, particularly from encouraging from the offshore investors to get involved. I guess with the volatility comes a hesitancy to invest large sums, and so people that would normally go bigger probably cut back on their orders, but there was significant interest and enthusiasm for the stock.
The initial price was put at around 17 rand a share, and we've had to settle for 13 rand 50. In your book, is that a fair valuation, or is there huge upside potential here?
I think we should also mention that the range was 1450 to 17, so we put that as a range.
Sure.
And we knew that in a volatile market we'd probably trade at the bottom of the range. So 1350, I think, certainly leaves some money for investors going forward. So I'm looking for an upside. I've learned long ago not to try and predict pricing. I leave that to the experts. My job is to make sure that we continue to perform to the same level we have in the past.
Yeah. In terms of the pickup that you have had from the private placement that you did, who were the main buyers? Let's talk about probably your main shareholders here. If you can give us a sense of who also got the shares abroad as well, that would be great.
I think there are a number of investors, the big investors offshore, the big asset management companies, the BlackRocks, the Hendersons, etc. They've all, in the South African context, we have the added problem that some of them are exposed to our two shareholders, Mvelapanda and Brimstone, who are in the process of unbundling. But even notwithstanding, we've had good support from the big asset managements like the Old Mutual and Stanlib's.
Okay. Let's talk about the assets that you're bringing in. I mean, we know you are in the private healthcare industry, and we know you are in the private hospital business, and we also saw the other day that you bought another private hospital in Mosel Bay. Let's just talk about the assets that you're bringing. What exactly is Life Healthcare Group, and what are you bringing?
Yeah, it's a large consolidated private hospital group with both chronic and acute care treatment. What that means is that we have 8,000 beds looking after what you would consider as a general hospital. Equally exciting, we have 4,000 odd beds where we look after long stay mental health patients. So it's a sizable asset in terms of bricks and mortar. But it's a national play. We have a very good geographic spread of assets throughout South Africa.
And the opportunity to be able to grow that, are you just looking at South Africa? Are you looking beyond South Africa? There is a huge amount of opportunity, I'd imagine, in the rest of the continent. We know about the challenges of government in providing decent healthcare for their folk.
Absolutely. I mean, we hope, you mentioned national health insurance. We hope through national health that we'll have opportunities here at home as well in helping find the ultimate healthcare solution for South Africa.
I was going to suggest it's a threat.
No, I disagree. I think the solution for healthcare delivery in South Africa goes to everyone. But there's also opportunities in our continent. We're currently looking at some acquisitions in our neighboring countries. And we will be looking at some of the pods that we think can support a healthcare system, West Africa, East Africa.
Where are you most excited? Because people talk about Africa and immediately you think of Nigeria, 150 million people potentially, and systems that clearly are struggling to cope with providing decent life for people there.
We're probably not really prepared to make a definitive answer, but I'm quite keen on Ghana because I know a lot of Ghanaian specialists, and so I think that is a system that has the skills on the ground to support private healthcare.
Now, finally, Michael, now you're coming into, well, you have already been competing against the big boys. You know, we're talking about Mediclinic, we're talking about Netcare.
Yeah.
In terms of competition, how intense is that? And where do you see yourselves? Let's go down the line, 5 years.
Certainly we're number 2 in the market anyway in terms of beds under ownership. So I don't think size is a big important thing. I think what South Africa should be pleased about is that we have 3 groups that are world class, that manage hospitals to the standard that we do, and that's an asset. It's a South African asset, and with our World Cup with us and the national pride and Bafana winning tomorrow night, this is all part of of where we think South African hospital players are truly an asset to this country.
Can I put you on the spot?
Yes, sir.
What's your score for tomorrow?
2-0 to Bafana.
Michael, we're going to be holding you to that.